Welcome back to the podcast. I'm your host, Rachel Vassar, and today we're diving into a topic that is truly groundbreaking: how innovative treatments like LUMIT therapy and neuroimaging are changing the way we approach mental health, chronic fatigue, and even trauma recovery. If you or someone you love has struggled with depression, anxiety, or exhaustion that just won't go away, this episode is for you. We've all heard the traditional approaches like medications, therapy, or just pushing through it. But what is there, or what if there is a way to actually repair the brain and restore health at the root level? That is what we're getting in today with my guest, Dr. Theodore Henderson, a renowned neuroscientist, psychiatrist, and expert in brain imaging and innovative brain therapies. He's the author of the book Brighter Days Ahead: Leaving Depression Behind Through Innovative New Treatments, and he's on a mission to revolutionize mental health treatment. In this episode with Dr. Henderson, we will break down how LUMIT therapy, multi-watt infrared laser therapy, and cutting-edge research are helping people heal their brains without any daily medications, without outdated chemical imbalance theory, and without the idea that you just have to live with these conditions forever. We're also going to talk about eye-opening discoveries like how viruses in the brain might actually be causing depression and chronic fatigue, the role of trauma in brain health, and why many traditional treatments are missing the bigger picture. I'm super excited. This is going to be a very powerful and insightful conversation, so get ready to rethink everything you thought you knew about mental health. Dr. Henderson, welcome to the show. I'm excited to have you here.
Rachel, it's so great to be here. Thank you for inviting me.
Absolutely. Is there anything that you would like to add about yourself and your expertise in this field?
No, you did a great job. I think you hit the nail on the head.
Awesome, amazing. The first thing I want to dive into is your background and your journey getting to where you're at. So first, I'd love to know what inspired you to dive deep into neuroscience and these innovative brain treatments.
Well, depending on how far you want to go back. I actually started out life as a musician,
Oh,
and
cool.
I went to college as a music major
That's cool.
and really had no interest in science whatsoever. And it was only in college that, I got my first taste of science and really woke up to, how exciting it is and how powerful it can be. And sort of through a series of progressions, I got to, deciding that I didn't want to be a marine biologist and I didn't want to be a psychologist. And I went to medical school. And in medical school there, I discovered, how interesting the brain was.
Mm.
And so I shifted to doing both an MD and a PhD. The
Wow.
PhD was in neurobiology.
Wow.
Had research grants as a graduate student and research grants as a postdoc while I was doing a residency at the same time. So busy,
For
sleep
sure.
was optional.
Yeah.
And I spent a year in radiology as a resident in radiology. I thought that'd be a good way. You read your stack of films and you go back to the research lab. Well, unfortunately, radiology and I don't get along. It wasn't my cup of tea, but I learned a lot of neuroradiology. And when the opportunity came up to get involved in functional brain scans after I had completed my training, I went for that and was working with brain SPECT scans. And SPECT scans are a functional brain scan. So you can see what's working and what's not
Mm.
working or what's working poorly.
Like what
Uh,
part of the brain is activated? Yeah.
exactly,
Okay.
exactly.
Cool.
And in that work, we'd get somebody's brain scan, we'd interpret it, and then we'd sit down with the patient and their family and we explain, okay, well, this scan shows that you have a brain injury.
Mm.
We don't have a treatment for that. Have a nice life. Can't do anything
Yeah.
for you. I hated that. I hated that.
Mm.
So when the opportunity arose, a colleague approached me about he wanted to do brain scans before and after he did a particular treatment. And he said the treatment was, we're going to shine infrared light on people's heads and treat their brain. Now, my reaction was the reaction that every single
Yeah.
doctor
Yeah.
has. It was like, you want to do what? And, so I was very, very skeptical at first.
Yeah.
But my one of the therapists in the clinic uh, uh, said, look, and her name is Jennifer. She said, read the literature, doc. He brought in a whole bunch of papers. Most of them were from Harvard. I said, really? Okay. So I sat down and read the literature, and it's absolutely was just mind blowing. The work at Harvard on, mice and rabbits had shown that, it was healing traumatic brain injury, was healing strokes
Wow.
in these animals um, by shining infrared light on their heads. And so,
Yeah.
when I realized that what they're doing was turning on neuroplasticity, I said, aha,
Ah.
I understand that because that was my
Yeah.
postdoctoral research work.
Yeah.
So it all fit together. And so that colleague and I then said, I basically said to him, look, this might work, but we got to
Mm.
grow it up so that, we're not treating mice, we're treating humans. Our skulls are much thicker. It's harder to
Yeah.
get through the scalp and the skull, and you have to have more power, but we had to do it in a safe way.
Mm.
And so that's what we went into the research lab and figured that out using sheep's heads and then cadaver material and then, living human tissue, that i.e. me. The human
Hmm.
hand is 25 centimeters thick. If you shine infrared light on this side and it comes out this side, you can measure how much penetration there is. And so we figured all that out, and we published that first paper in 2015. So LUMIT stands for laser, and laser, what is it, Star Wars? Are we shooting things?
Yeah.
But laser
That
is
was my initial thought.
right, exactly. Laser is coherent light, so all the wavelengths are traveling
Okay.
together. Okay, they're
Yeah.
all in lockstep. That's really what laser indicates. We're not getting technical here. So LUMIT, L is laser, U is unattenuated. That is,
Okay.
we have enough power to get through the scalp and the skull and into the brain of
Yeah.
a human. The M stands for multi wavelength and multi-watt. So because the power you need to get through the scalp and skull is multiple watts, multi-watt. And the I is infrared, and the T is treatment. So LUMIT is
Cool.
easier to say than laser unattenuated
Yeah,
multi-watt infrared light treatment.
definitely,
There you
for
go.
sure. What does, can you explain what multi-watt means again?
Sure,
Not to get
absolutely.
into the technical
Oh,
details,
yeah.
but I
Well,
like to
no,
know
it's
how things
important.
work.
This
Yeah.
is it's very
Yeah.
important because out there on the internet and it's starting to show up in all sorts of YouTube videos and Amazon is selling infrared devices.
Hmm.
Oh, you get this infrared device and stick it on your head and it'll fix your brain. Well, the problem is those infrared devices are putting out 1/2 of a watt.
Okay.
1/2 of a watt penetrates like less than a millimeter of skin. So it doesn't even get through the skin of your forehead. So it's not going to get through your skull and into your brain. Multi-watt means multiple watts. So like 10, 12 watts of energy
Okay.
is being delivered to the scalp. And the scalp absorbs about 60% of that, and the skull absorbs another 40% of it. So what actually gets to the brain is like, you know, 2% of the energy that you actually put on the scalp.
Mm.
Okay.
Okay. So you need to have multiple watts in order for the infrared to actually get into the brain.
To get into the brain. Yes. And
Interesting.
yeah.
Yeah. How long did it take for you to figure out how many watts or wavelengths was necessary to penetrate actually into the brain?
Mhm. Yeah, that was a series of studies, and we published that again in 2015. It took us about 8 months
8 months?
to collect all the data, and then another probably 6 months to write it up.
That's cool. So you've done a lot of research into how to get the near infrared light therapy actually
Hmm.
into the brain.
Hmm.
Um, how long have you been able to actually implement this in a therapeutic way? And what
Mhm.
sort of transformations have you personally been able to see in using it?
Yeah, a great question. So we started in 2013 treating patients, and we were able to, do a functional brain scan, treat the patients, and then do a functional brain scan on some of them afterwards. And so let's take, for example, traumatic brain injury. Traumatic brain injury patients often, 100% of them have sleep problems. A lot of them have irritability. A lot of them
Mm.
have depression. You're 6 times more likely to become depressed after a concussive injury. So a
Wow.
lot of them had depression, a lot had
Yeah.
anxiety. I mean, we had patients who were on the verge of divorce and they couldn't keep a job, and they came in and they got treated. And, 20 odd treatments later, they feel so much better. They're sleeping better. Their mood is better. Their depression is gone. Their headaches are gone, and they're able to get a job. We were treating a fair number of veterans. Veterans have a special place in our heart. And in fact,
Mm.
we have a foundation, the Neuro Laser Foundation, to help subsidize the treatment of veterans and first responders.
Oh, that's
Um,
cool.
yeah,
Yeah.
um, the some of those veterans were, had come back from, one was a bomb diffuser,
Mm.
and so he had been subjected to 10 separate blasts.
Oh my gosh. Wow.
Yeah. And so his brain scan looked, well, Swiss cheese looks better than the brain scan.
Oh yeah.
And
Wow.
after treatment, he was doing so much better. He got a job as an engineer at a local brewery, and he's still there as an engineer, doing great. His marriage was saved. Remarkable
Amazing.
difference. Yeah.
Amazing. Yeah, that is super cool. So definitely really helpful in traumatic brain injuries and the I guess, consequential depression or anxiety or issues that can
Hmm.
come with it. Another part that I wanted to talk about that I know you mentioned a lot um, is its role in chronic fatigue syndrome.
Hmm.
I would love
Hmm.
to dive into how it helps people in overcoming chronic fatigue because that is a really common issue that a lot of people are
Right.
dealing with nowadays.
Hmm. Yeah, as it happens, again, out of this neuroimaging work, I had gotten interested in chronic fatigue syndrome and was treating a number of patients. In fact, when was that? 2012, 2012, I believe. I published a paper on a series of kids with chronic fatigue syndrome that I had treated to recovery.
Mm,
So I was already very interested in that. Now, the important thing about infrared light, let me pause for just a second and get this concept out there. Infrared light, certain wavelengths of infrared light activate the mitochondria within the cells. That's the little organelles that make energy. Now, that
okay.
makes more energy, which helps the
Yeah.
cell, right?
No,
But
for
it,
sure.
yeah, but the mitochondria also then send signals to the chromosomes to start turning on certain genes and making certain proteins. Those are anti-inflammatory proteins and also growth factors like brain-derived neurotrophic factor, or
Mm,
BDNF. BDNF is the driver of neuroplasticity and brain repair in the adult brain. So by turning on, neuroplasticity, that's why infrared light works. Now, the thing to keep in mind, though, is any cell that it touches, it's helping. It's helping it to function better. It's helping the mitochondria to work better. It's helping and so any neuron or any cell it can be helped with infrared light of these particular wavelengths. So when we talk about infrared light helping all these different conditions, it's because it's helping the cells. If you help the cells, then, and it's maybe the cells of a lung of someone who's got long COVID and can't walk up a flight of stairs without getting shorter breath, and we treat those lung cells, then they can go back to hiking in the mountains,
yeah.
right? And same thing
Yeah.
with the brain. Doesn't matter what the condition is. So, it works on depression, it works on anxiety, It works on PTSD. Interestingly, we're finding that it works on ADHD.
Oh,
And
interesting.
yeah, and there's 4 studies using LEDs showing that it helps autism. And we've treated patients and it helps their autism. And, so it doesn't, dementia, Parkinson's disease, chronic fatigue syndrome, long COVID, the brain fog and the fatigue of long COVID, that's all
Mm,
treatable. It's all treatable.
yeah. So it's like it doesn't care what your issue is. It can
Right.
help you heal.
It's not condition specific. Right.
Yeah,
Yeah.
that's super interesting. Another kind of like side question that I had
Yeah.
about
Mhm.
infrared light therapy, kind of in general, not just like talking about the brain, but obviously when you're trying to treat the brain, you want to make sure that you get like something that you can put on your head that can penetrate into the brain. But if you do like general infrared light therapy to where it's not like specific to your brain, but kind of like to your whole body type of thing, or like
Mhm.
general part of your body, can that still have a positive effect to other areas of your life because it's improving the functioning of those cells? Or when it comes to neuroplasticity, does it need to be specifically targeted to the
Mhm.
brain?
That's a great question, and it gets to a really important aspect of the infrared world. Right now, as I said, you can buy a device and stick it on your head, and you think you're treating your head with half a watt. Those devices do something. They
Yeah.
actually do something. There are published studies showing, yes, these low power LED devices help depression. The depression gets a little bit better. Or the traumatic brain injury symptoms get a little bit better, or the autism gets a little bit better, or the cognitive impairment of dementia gets a little bit better, as long as you keep treating. As soon as you stop treating, the benefit goes away.
Hmm.
And so, again, they're not getting to the brain, even though they claim they are. They're getting
Yeah.
to the skin.
Okay.
And we showed in a study, and it's been showed by a number of other people, John Stone down in Australia, et cetera, that infrared light applied to any part of the skin, you could put it on your hand, you can put it on your arm, and it will have effects on the entire body.
Okay. Yeah.
So these, infrared saunas, the wavelength's wrong. It's not the right wavelength. And these, so infrared saunas really what they do is they help inflammation. But if you take a infrared LED pad and you stick it on your chest and while you watch TV for a half hour, you will help your health by an indirect effect mediated by the skin.
Okay. So infrared light therapy will help you in different ways, but if you're wanting to specifically target neuroplasticity in the brain, let me get this right. If you want to have like long-term changes, like if you have traumatic brain injury, you need to have very specific
Mhm.
multi-watt proper no, multi which one is it? I'm getting them confused. Is it multi-watt?
A multi-watt is what penetrates, yes.
Yes, multi-watt to actually get into the brain to
Mhm.
see those long-term changes without having to do it every single day. Am I hearing that
Correct.
correctly?
Yes,
Okay.
that's the remarkable thing.
Interesting.
So,
Yeah.
the patients that the veteran I was talking about who had 10 concussions, um, we treated him 12 years ago. He's still doing great.
Amazing.
Uh, but if you
Yeah.
do these low power devices, you have to do that every day for the rest of your life. It doesn't
Hmm.
create a permanent change, and the change is much smaller.
Hmm. Okay. So it's pretty small and has to
Mhm.
be kept up for as
Yes,
long as you want the benefits.
that's right.
Okay,
Should we get
that's
back to
super
chronic
interesting.
fatigue?
Absolutely.
Okay, because I,
Absolutely.
I I didn't want to slight chronic fatigue. I think it's a very important topic. So one of the things about chronic fatigue syndrome that people don't appreciate
Hmm.
is that most of chronic fatigue syndrome is caused by a virus infection.
Okay. Yeah.
And the most common virus is Epstein-Barr virus.
Hmm.
And that's been shown by a number of studies, and it's quite clear. Epstein-Barr virus has another name, herpes 4. It's a herpes
Interesting.
virus.
Interesting.
There are 12 herpes viruses that affect humans, the poster child is not the one that everybody's thinking as they cross their legs. It is herpes 3. Herpes 3 has another name. It's called varicella or chickenpox. So what's chickenpox? You get an acute illness, you have a virus, you break out in a rash, and then a couple days later it goes away. But the virus doesn't go away. The virus sets up house inside your body. And if you're going to pick a cell inside your body to live in, you want to pick one that's going to live a long time, right? So you don't pick a liver cell, they got about 400 days. You don't pick a white blood cell, they got about 30 days. You don't pick, even a heart cell, they turn over. Neurons, brain cells, don't turn over. They are there for decades. Okay. So that's why varicella sets up house inside neurons. And then years later, when you get older or you get sick or you get stressed, varicella comes out again as shingles, right?
Shingles, okay.
Yeah.
Interesting.
So shingles is chronic varicella. And now there's television commercials, shingles is sleeping inside you. Almost everybody has it, right? Get the shingles vaccine. But doctors don't seem to be able to equate that lifestyle of varicella is exactly the same thing that Epstein-Barr does, and exactly the same thing that herpes 5 does, and exactly the same thing that herpes 6 does. And herpes 5, 4, 5, and 6, Epstein-Barr, cytomegalovirus, and herpes 6, are the causes, in most cases, of chronic fatigue syndrome.
Interesting.
And so, their herpes virus, treat them with an antiviral. And so that's what we do. And the Stanford clinic for many years was treating with antivirals. And Nancy Klimas down in Florida is treating with antivirals. I learned what Dr. Lerner was doing, A. Martin Lerner. He passed away about 15 years ago now, and started doing what he was doing and started seeing patients getting better. And so realistically, about 80% of my patients with chronic fatigue syndrome get better. Now, we can't kill all the virus, is the hard part, number one. And we had to undo the damage that the virus did to your brain. And that's where LUMIT comes in. We go in and we treat the brain, and it gets re-energized, and it starts to repair itself, and the damage that the virus caused, we start to repair it.
Interesting. So again, I just want to make sure that I get that straight. So you're saying that most chronic fatigue is caused by a virus, Epstein-Barr virus. So your way of treating most chronic fatigue is antiviral medication and then the LUMIT therapy? And you've seen about 80% success rate with this? And again,
80% success rate just using the antivirals.
Oh, okay.
So,
and then like 100% using the LUMIT.
Well, I mean, I wish I got there yet. I mean, part of the problem is that chronic fatigue syndrome is a syndrome. It's not a disease.
Yeah.
And its most common symptom is fatigue. And if you do too much, then you crash. You have, post-exertional malaise. How is that different from long COVID? Answer, it probably is not. It's probably the same thing. But how is it different from chronic Lyme disease, which can present with exactly the same thing plus other things? And so it gets hard when you have a patient who has fatigue, unless you do a couple $1,000s worth of testing to rule out, Lyme disease and Bartonella and Babesia and Borrelia relapsing fever. I could go on. But, to rule out those kinds of things, it's expensive, and those labs aren't covered by insurance, et cetera, et cetera. So, that 20% that doesn't respond, I start digging into, okay, what are the other causes? What else is going on? Is there mold? Is there Lyme disease, et cetera?
Interesting. So is the virus medication something that you can I guess, give to people if you don't exactly know what virus may be causing the issue, and it kind of works in more of a broad way, if that makes
Mm,
sense.
well, I tend to do labs,
Okay.
like a lab core kind of set of labs to give myself at least some data to work from.
Yeah.
I also do a whole series of fatigue questionnaires, so I have some metrics. So we can see, okay, yeah, your fatigue is definitely getting better. Look, your scores are improving. And then I'll make the decision to start treating.
Do you start treating, do you mean treating with the Lumit?
Well, no, I start treating with antiviral, to be clear. Yeah,
Oh,
in the
okay.
case
What
of
do you
chronic fatigue.
do before you do the antiviral?
Assess the patient, so, there are diagnostic criteria that we need to see that, yeah, the patient has those, has crashes and has fatigue and has disrupted sleep. And, they don't have enlarged lymph nodes, or they don't have, uh, you know, stria that indicates that they actually have Bartonella. So, an exam and an assessment. And then
Okay.
and then a set of labs to identify if there's
Okay.
any indication of these viruses there.
Oh, okay. I wasn't sure if you had meant that you did some sort of medication before the antiviral, so glad to have
Mm,
cleared that up for sure.
yeah.
So I want to kind of give some clarification for the listeners here as to the role of viruses, because we've been talking about viruses and chronic fatigue
Hmm.
mainly. Um, but I know you've kind of mentioned a little bit about viruses' influence in mental health issues
Hmm.
as well. Can you dive into how that may affect your mental health as well, not just the chronic fatigue, like what
Hmm.
influences go on there?
Absolutely. Absolutely. So, in the book, Brighter Days Ahead, I'm talking about treating depression in an innovative way. And I use ketamine as a model. Ketamine turns on neuroplasticity. That's why it makes people feel better. That's why it cures up depression, because depression is a degenerative process in the brain, and ketamine turns on neuroplasticity. And so it undoes the degeneration. The frontal cortex gets bigger, the amygdalas get bigger, the hippocampuses get bigger and healthier. So all of that is going on as a result of neuroplasticity. So you would think that ketamine would work 100% of the time. It doesn't. About 22%, 23% of people are non-responders, even to this most powerful antidepressant drug on the planet.
Mm,
So why? Why are they non-responders? Well, one reason is they may have a traumatic brain injury that nobody diagnosed.
mm,
And so, because again, your chance of having depression after a concussive event is 6 times higher than the general population. The second reason is you might have a viral infection. And I see that quite a bit. So in treating chronic fatigue, I have patients who come to me, they have fatigue, but oh yeah, they also have Parkinson's, or they have fatigue, but oh yeah, they also have depression. They have fatigue, but oh yeah, they also have really bad anxiety, or they have fatigue, and oh yeah, they have seizures. And that's a really remarkable one, to see someone who has a seizure disorder, treat them with an antiviral, their depression goes away, their seizures drop dramatically in frequency, and their cognitive function gets better. In fact, one gentleman fit exactly that bill. He could not believe, he said, Doc, there's no way that this is due to a virus. I just cannot believe this. He says, I'm going to stop taking the medicine. I said, well, okay, let's make an appointment in a month because you'll be ready to get back on it. And in 2 weeks, he calls me up and says, my wife is demanding that I get back on the medication because I've become so forgetful and my seizure frequency has gone up. It's like, there you go. So,
wow.
again, we were talking about the idea that laser treats cells, LUMIT treats
Hmm.
cells. Doesn't care where the cell is, it'll make the cell healthier.
Yeah.
Viruses attack cells. They don't care where the cell is or what the cell in your brain does. They don't care if it's in your speech center or in your motor cortex or in your the part of the brain that's involved in Parkinson's. It's just mucking up brain cells.
Yeah. I do have a question. I'm not sure if it's kind of like I don't know what the word would be, but I am curious if you, because a lot of people tend to just talk about infrared light therapy, and I
Mhm.
honestly have not heard a bunch of people talk about viruses and their influences in chronic fatigue syndrome, depression, anxiety, etc. And so I'm curious if you only treat it with infrared light therapy or the Lumit
Mhm.
without the antiviral, can it still, or I guess my question is, can it have such a positive effect on the cells in your brain that it can actually fight against, possibly, I guess, expel the virus, or will it kind of just be reducing the symptoms, but it's still there?
Mm.
I hope that makes sense.
It does. So
Okay.
imagine you got, a neuron that's infected with a virus. And
Okay.
it's getting beat up. Its mitochondria are exhausted, and it's barely able to function. And you come in with infrared light and Lumit, and it reaches the mitochondria and activates the mitochondria, and the cell gets healthier. It's still infected.
Hmm.
So the offender is still there. It's like if you have mold in your house and you just paint over it, the mold is still there.
I know someone who did that. I was like, I don't know about that.
Yeah.
Okay. Okay. So even if the health of your cell improves dramatically, it won't be able to expel the virus. It'll still be there, and you'd need to use an antiviral medication in order to actually heal the root cause of what's causing these issues
Mhm.
in the first
Mhm.
place.
Correct. Correct.
Okay, interesting. That's definitely really good to know, and to clarify, because I hear so many people talking about the infrared light therapy, and I think there's definitely a missing piece in the influence that viruses can have
Mhm.
on the body. So I'm really glad that you're getting this information out for sure, because it's something a
Mhm.
lot of people are missing. Um, I want to dive into the chemical imbalance theory. I hear a lot of people when they have like depression or anxiety, they're like, yeah, it's just like a chemical imbalance thing.
Mhm.
Like, I can't really do anything about it. So I just have to kind of manage my symptoms. I'm like, well, first off, you don't even know what you're saying. That's just what your therapist told you. Second off,
Mhm.
I know you mentioned that you've moved past this theory. First thing, I I personally don't quite understand the chemical imbalance theory influence in what they say it's causing to the brain. So if you could
Mhm.
explain that a little bit, and then explain why you've moved past this theory and its influence in mental health.
Mhm. Yeah, absolutely. So the theory really came out of a desperate attempt to try and explain why tricyclic antidepressants and SSRIs worked at all. We don't understand why they work. And tricyclic antidepressants are the old antidepressants from like 40 years ago. And they worked on a lot of different receptors. So the idea that they came up with to try and explain this was, okay, well, if you don't have enough serotonin, then your brain parts that depend upon serotonin can't function properly. And so we had to increase the amount of serotonin floating around in your brain, or dopamine or norepinephrine, depending on, what's going on. And so that's what the SSRIs do. The SSRI stands for selective serotonin reuptake inhibitor. So it slows down the recycling of
Mm,
serotonin, so more serotonin is sitting in the synaptic space. Um, that supposedly makes those neurons function better. Now, the problem with that is that the data largely says that's a bunch of nonsense.
interesting.
It was cooked up as a marketing scheme. You remember that
Hmm.
little Zoloft? You may not, but
I
I
mean,
mean,
I don't think I do.
okay. I mean, this
I
is like an
might.
early Zoloft commercial from probably 35 years ago. They had
Uh,
this little uh, curly Q cartoon walking around with a rain cloud over it, and then it gets Zoloft, and then the sun comes out and the bird
Oh,
comes over and it's
interesting.
bouncing up
Yeah.
and down. It's very happy. And it was a marketing scheme.
Hmm.
And so there have been 4 big meta-analyses. That is where they take data from a whole bunch of studies and put it in a statistical blender and come up with an answer. And 4 meta-analyses have said serotonin has nothing to do with depression.
Really?
Yeah.
Interesting.
You want
Yeah.
another
Yeah.
tidbit? Okay.
Yeah.
So Prozac is one of the oldest SSRIs. It increases serotonin supposedly. Um, Prozac increases serotonin within hours. Hours. So it has another name. It's sold as Serafem, and Serafem is for premenstrual dysphoric disorder, what most of us think of as PMS. You don't take it all month. A woman, 3 days before her period, a woman will start to take Serafem, Prozac, and immediately they do better. They get through that horrific 3, 4, 5 days of PMDD without feeling irritable and cranky and not being able to think. And believe me, I've seen the brain scans. It's a real thing.
Hmm.
Um, but that Prozac is kicking in an hour to a few hours to a day for PMDD. But why does it take 6, 8 weeks for Prozac to work on depression
Hmm.
when the serotonin levels have been up, since day one?
Yeah.
So that's proof that really serotonin has nothing to do with this. What Prozac does
Interesting.
for depression is very slowly, very poorly. If you're lucky, you've got the right genes, and the moon is in retrograde in Sagittarius, that you'll get some antidepressant relief. But it's really, really, not better than about 20% of the people who take Prozac see benefit. That's
Interesting.
true for all of the SSRIs.
Yeah. So I've definitely heard a lot people saying, yeah, serotonin is really important in depression and your mental
Mhm.
health, etc. But now you're saying that serotonin is not even involved at all
Correct.
in depression.
Mhm.
Can you maybe explain a little bit about how they came to that conclusion?
That it wasn't, or
Yeah,
that
that
it
it didn't
what?
work. Like, I mean, you could explain it better than
Okay.
better than I can give an
Well,
example.
yeah. So they looked at a lot of the study. They looked at a whole bunch of studies where they increased serotonin in people's bodies
Okay.
and saw zero benefit. It made no difference whatsoever. And they've seen given patients serotonin depleters, so they get rid of a lot of the serotonin in the body, and those people don't get depressed. So that's just 2, types of studies that really looked at this question. And just the timeline of Prozac, I mean, that's pretty
Yeah.
clear.
Oh, for sure. For sure.
Yeah.
So, uh, do they have like any idea of how SSRIs influence depression?
Well, again, there is data for Prozac and Effexor, venlafaxine, and amitriptyline that they actually turn on brain-derived neurotrophic factor. They turn on neuroplasticity very
Okay.
slowly,
Very
very
slowly.
weakly, if you're
Okay.
lucky.
Yeah. Okay, so it doesn't even serotonin doesn't even have any part of it. It's the fact
Yeah,
that they're able to
it's
kind
a
of
happy, yeah, it's a happy
yeah,
accident.
they're kind of able to activate neuroplasticity. Okay, that's
Mhm.
super
Yeah,
interesting.
yeah.
I had no idea that they had that influence on the brain. People
Mhm.
literally just capitalize on serotonin so much. So that
Yeah.
is really interesting to learn.
It's held the field back. It's really held the
Yeah,
field back.
I can see that because I've heard that a lot from like psychologists,
Mhm.
a lot. So that's interesting that they kind of, I don't know, because you discovered this 2013, that or the laser therapy 2013. When did you kind of discover that serotonin didn't have an influence in depression?
Well, I've always disliked SSRIs,
Yeah.
and looked at other ways of trying to treat depression. I started a ketamine clinic, the first ketamine clinic in Colorado, 13th in the country back 11 and a half years ago. because I really see that depression it isn't isn't due to chemical imbalances. I've written about that for years. But now we have, even more proof that dismisses that. So I don't know that I discovered anything.
Yeah, well,
You
I
know,
meant like when did you kind of like I guess my question is like it's a little bit confusing because it seems like you've kind of been able to notice that a lot in the field for a while, but it seems like a lot of people in the psychology, neuroimaging field kind of haven't really gotten there yet from like the popular people, I guess you could
mm.
say. And so I'm kind of just curious why they haven't gotten there yet. Like what your thoughts are on that.
Yeah, so the chemical imbalance theory is so ingrained into our culture. I mean, it's taught in high school biology and psychology. It's taught in colleges. It was taught in medical school. They fed me the same Yahoo uh, stuff in residency. And the algorithms that are out there, sort of the ingrained, this is what you do. Oh, you get a kid
Mm,
who's depressed, put them on Prozac because supposedly Prozac doesn't increase suicidal ideation. That's also been proven to not be true. um, so but the algorithms are ingrained. I saw a
mm,
patient yesterday. She had, been on 3 antidepressants, and she was off antidepressants and in a bad relationship. And then she got really scared about her safety. She checked herself into an inpatient unit. They put her on Zoloft and Abilify, an antipsychotic. Why? Because Abilify is FDA approved as an augmentation strategy for depression, but you're putting someone on an antipsychotic. Now, I
mm.
think antipsychotics are good medications and appropriate when they're appropriate. I started a young person on Abilify 2 weeks ago, but not to use them cavalierly and not to use them when you haven't exhausted everything else before you go to, an antipsychotic. So, but that'd be another
Yeah.
podcast.
Yeah. Kind of overcoming what is ingrained in the field is very
Right.
difficult.
Mhm. Right,
Yeah, I
right. I mean, yeah.
definitely understand that for sure. Um, Let me see here. I had another question that I wanted to ask. Oh yeah. So you definitely talk a lot about like medication and using infrared light therapy for helping people heal.
Mhm.
Actually, my first question, actually, I wanted to
Yeah.
ask was, have you been able to see the difference, like if you have any data on the difference between how much, let's say SSRIs activates neuroplasticity versus the LUMIT? Do you have any data on that?
I don't,
Okay,
but I can tell you right now, our depression
a lot.
study. Yeah, so we published a depression study in 2017, and the response rate to Lumit was 93%. The
That
response
is
rate to ketamine is in the 70s, and the
70s.
response rate to SSRIs is like between 17 and 25%.
That's what I was asking. That's definitely really good data to kind of
Mhm.
uncover the differences in therapies there. Why do you think that Lumit has kind of struggled to become more of a mainstream therapy for people struggling with depression?
I mean, I was out in LA and talking at a meeting, and I was talking with a few other folks that do infrared light therapy. And we've all had the same experience. We try to explain it to a doctor, and they'll get 30 seconds in, and then they'll just say, well, that's a bunch of nonsense. It's not taught in medical school, and doctors, I hate to say this, but doctors don't read a whole lot. And think about what I said. My initial reaction was, I thought that, well, that's poppycock.
Yeah.
And Jenny Verity said, sit down and read the articles. It's amazing. And that's every time I present, the audience is just blown away because I can show brain scans before and after, and I can
Yeah.
show depression scale scores, plummeting. And whether it's PTSD or long COVID or kids with autism who are much less anxious than they used to be. In it's a profound change that we're seeing for patients. And just once doctors give it a few minutes to understand what it is we're really saying, they then get excited. But most doctors are just closed-minded about this.
Hmm.
Yeah,
That's
it's a
definitely
shame.
unfortunate. That's
It's a shame.
unfortunate because of how much it can positively impact
Hmm.
so many people. Like, I
Yeah.
don't know, I know way more people who are influenced by these things than who don't have any issues with them. And
Hmm.
if this
Hmm.
was, when we're able to get this in a mainstream treatment,
Hmm.
hopefully that's going to be very transformational and super
Right, right.
exciting. My last question for you, kind of just wrapping up here,
Hmm.
is how important do you think lifestyle and nutritional factors are in helping support the body and healing when coupled with LUMIT and
Mm.
possible like medication therapy?
Oh, yeah. I mean, so I've become more and more of a proponent of a broad spectrum of holistic treatments. I was very rigorous and scientific when I started out. But so for example, in anxiety and depression, I'm always encouraging patients to meditate. And I let them know, look, meditation's like playing the piano. You're not going to sit down and play Beethoven the first time. It's going to
Absolutely
be,
not.
it's a learning curve.
For sure.
And I worked very carefully with my chronic fatigue patients and my post-COVID patients on energy management while we're working on the treatment. The antivirals take months and months and months to work.
Mm,
And it's like Lyme disease. Lyme disease takes months and months and months and months to treat.
absolutely, yeah.
And my so energy management, I say you got to think about it this way. You need 20% of your energy to repair. You get to spend 80. If you spend 100, you're taking away from the repair. And
Mm,
everybody knows this who's got chronic fatigue.
yeah.
You're here, you crash, and then when you recover, you don't recover to here, you recover to here. And it takes
Yeah.
a long time to get back to here. So patients who have lived with this for a while know that. And it's really important to help them to know they've got a budget. And one of the things we see with the antiviral therapy is that patients will start to feel better. And they got that long list of to-dos that they want to do. Like I had one guy, he started to feel better. So he signed up for a, military style boot camp weekend
Oh, oh my
workout
gosh.
routine and threw himself back into a crash. And it's
Oh
like, no, 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 no,
no.
no. You forgot about the 20%.
Mm.
So, and so it's a really important piece of the puzzle. I also use a variety of herbal medications that have antiviral properties, and I bring in things that are mitochondrial support supplements. So, of course, if we're seeing gut issues, I love getting people on a couple of probiotics to help get
Love
their
that you mentioned
microbiome
that.
back on in shape. Yeah, it's very,
Yeah.
very important. Um,
Yeah.
JAMA puts out these little email blasts, and so the oncology one comes out like once a week, and I read them all. Every week, the oncology has something about the gut microbiome and its role in getting better from cancer. It's really important.
Wow. Yeah.
Yeah.
As a holistic health coach myself, gut health definitely plays a huge role in
Hmm.
how I support my clients through healing. I almost
Hmm.
never, ever see any client who has some sort of a health condition and their gut health is absolutely perfect. They may say it is,
Hmm.
but once you get
Right.
into it, it's like, no, not quite. So, yeah, the gut microbiome is definitely something that research is developing a lot. We still
Hmm.
honestly, I mean, from what I understand, especially with like probiotic strains, it's something that research is still developing on. But it's super interesting the developments that they're seeing and like how they can use specific um, probiotic strains to help like treat certain things or certain
Hmm. Hmm.
symptoms in the body, which is very interesting. I'm very
Hmm.
excited for the day when we understand a
Hmm.
lot more and how to utilize certain strains for certain things and have concrete evidence towards it. So that's super interesting. I kind of get talking when we start talking about gut health and stuff.
There
But
you go.
um I think that's all of the questions that I had for you. I'd love to end off with some final words of wisdom for my audience. So, if someone is struggling with depression, anxiety, or chronic fatigue, what is one piece of advice that you would give them?
And I would add long COVID to that. I think long COVID is just underappreciated. The
Mm,
government spent millions of dollars to be able to tell you what the symptoms are. I mean, I can pick a patient and they can tell you what the symptoms are. Um, but you know, in number one is that we're in a revolution. You know, the gut is being recognized as an important part of mental health.
yeah.
And we're getting away from these traditional SSRI type medications. If someone is saying that you have chronic fatigue, and if someone's saying to you, it's all in your head, or they're there, you just need to exercise more, get a different doctor. Call me. Um, I can't stand that. That is infuriating to me. It's insulting to the patient. If you have long COVID and they're telling you there's nothing you can do, I had a gentleman from Austin call me yesterday. So, oh yeah, the doc said, yeah, you have chronic Epstein-Barr virus, but there's nothing we can do about it. Excuse me? It's a virus. We have an antiviral for that. Really,
Yeah,
guys? You know, so again, call me.
absolutely.
And you know, if you're taking an antidepressant and you're not joyful and your life is flat and you're trudging through the day, get a different doctor. Simple as that.
Absolutely. How can my audience get in touch with you?
That's very easy. So neurolumits, it's hard to spell. So healmybrain.info, healmybrain.info. And you can just call me directly. Look me up in Google me. I'm right there. I've got a ton of YouTube videos on the Neuroluminance channel. If you guys are curious about, all the different things that infrared light can help. Because again, it helps the cell. It doesn't treat a condition.
Absolutely.
And
And I'll be
yeah.
putting all of your information
Oh,
down in the
excellent.
description for everyone too, so you guys can check down below.
Great. Excellent.
And then my last question is, how can people get their hands on limit therapy if they're not in the same place as you?
I mean, we have patients who come in from out of town all the time. I have three people in the clinic right now, two from California and one from Florida. It's right. We are working on getting a clinic in Florida. We're not
Oh,
quite there yet, but I think there should be a clinic in every city. Uh,
I
but
agree. Yeah.
patients come out. You don't have to do it all at once. Here's the important thing, right before we go. People come out and they'll do 6, 8 treatments and go home for a month. And they'll come back to do another 6, 8 treatments. And they almost to a person, they pulled me aside and said, Doc, this is weird. I feel better than when I left. And because we turned on the neuroplasticity and it keeps cooking. It's cooking even when the LUMIT light is not shining on your head, it's still cooking. And so your brain is slowly but surely repairing itself.
Interesting.
Mhm.
This is totally another question. Does it have an impact or a positive influence in autoimmune disorders?
Oh, great
Or is it something that
question.
hasn't
Yeah,
been quite researched?
I don't know of any data on that yet. I can
Okay.
certainly check with next time I'm the Harvard Grand Rounds. I'll ask if anybody has any data on autoimmune.
Yeah, that'd
I'll
be
let you
super
know.
interesting to see if it has any influence on that for sure. Well, thank you so
Yeah,
much for that
absolutely. It was a
information.
pleasure.
This has been an absolutely eye-opening conversation. So thank you for sharing your expertise. If today's episode resonated with any of you guys, be sure to check out Dr. Henderson's book, Brighter Days Ahead, and follow him for more insights on brain health and innovative treatments. Innovative treatments. Again, his information is going to be in the description box below. Um, so thank you for tuning in, and as always, make sure you trust your bodies and keep moving towards true health. See you next time.